So hello to all the viewers. With me, I have Dr. Soumya Ranjan, who has got rank 8. Okay, rank 8 in the NEET SS medical group exam. So Soumya, welcome and hearty congratulations.
Yes, sir. Thank you, sir. Thank you so much, sir.
So how is the feeling right now, having secured a rank in the top 10 in a national level exam?
Yes, sir. Can't express right now in words, but it is a great feeling, sir.
Okay, all right. Okay, fine. Soumya, the viewers would want to know from you from which college you did your MBBS and MD from. So please tell them about that.
Yes, sir. Yes, sir. Basically, I, sir, belong to Odisha, and I did my MBBS from BSS Medical College, Burla, and then I pursued MD Medicine from RML Hospital, New Delhi.
Okay, all right. Okay. So just tell us a bit about your journey in DocTutorials, because you have been following DocTutorials and you have used DocTutorials, especially for preparing for in the latter part of your preparation towards your exam. So first tell us, how were the MCQs in the Qbank of DocTutorials? You have done the elite exams also. So how did these solving these questions help you?
Yes, sir. Actually, I subscribed in the late of my third year DocTutorial. I subscribed for the question banks and test series. Actually, it helped me a lot. Actually, the question bank are most of scenario based, and both also their single one-liners are also there. All are hand picked and all are from Harrison. So it is basically revising the entire Harrison only. So I felt it really boosted me. And the grand tests are also have similarities towards the NEET SS exam. So it is also, but right now the last NEET SS it has more of a one-liners, but still in the grand test, if you solve the lengthy STEM questions, then you will get to know more of the one-liners from the question itself. So it will be better if you stick to the lengthy questions or STEM questions only. So I felt and elite tests are also, they are not been taken from anywhere else. They have been handpicked by the teachers itself. So I think it is a great experience solving the MCQs and the tests.
Because the elite exams specifically, all the questions were framed by the faculties and especially the most important ones. And as Soumya rightly said, see, when you prepare for a super specialty entrance exam, the pattern keeps changing. Soumya, you would agree with me that the previous NEET tests, we had a lot of clinical long stem questions, but this one slightly more factual questions. So I think you should be ready with all sorts of questions. You should practice all sorts of questions. Correct, Soumya? Soumya, you're muted.
Sorry.
Yeah, Soumya, I was just telling the viewers about the importance of solving all type of questions, right? From simple, medium, and tough, because you cannot totally predict the exam pattern, correct?
Definitely.
So Soumya, again, a question which many students often ask us, and definitely they would want to hear from a topper like you. What percentage of the questions of the current exam came directly or indirectly from Harrison?
Yes, sir. More or less 85% around questions, even more, I would suggest they are from Harrison only. And some are the newer things, and some are like newer things only. But rest around 85 to 90% questions are from Harrison only.
Okay. And how do you see the weightage of individual subspecialties? Any subspecialty had a slight more advantage or so?
I don't think so, sir. Actually, questions are like that. The questions are you can't say that it is only a neuro question or it's a cardio question. Sometimes there are a mix up of questions. It can be from any specialty. So that's really, I don't feel like there are any advantage of any specialty.
So basically what Soumya is telling is, for the exam, there was more or less an equitable distribution of the questions, right? All right. So Soumya, just tell the viewers also, that what was your strategy for Harrison? Did you read Harrison cover to cover or specific selected areas?
Yes, sir. I was Harrison. I have read from cover to cover only, sir.
Okay.
But I have finished it around 4 to 5 times, I think. Then I was solving MCQ, so that it was pushing me to retain the Harrison.
Okay. And Soumya, again, talking of MCQ practice, you have written the various grand tests. So what were your approximate ranks in the various grand tests that you gave at DocTutorials?
Yes, sir. I have given around 5 to 6 grand tests, and in all the grand tests, I was within the top 10 usually.
Okay. So again, which closely matched your final rank as well.
Yes,
So
sir.
Soumya, I think it's very important for the upcoming candidates also to give the grand test just to see where you are. Maybe even if you are not initially in very good rank range, you still have opportunity to improve. But the mistake happens when you do not practice enough grand test. You just keep on reading without practicing. And then when you are faced with a grand test, you make mistakes, silly mistakes. So that is when the problem happens. And as Soumya rightly said, practice more and more questions. So Soumya,
Yes.
with a rank of 8, I'm sure you are eligible for any specialty in probably any college of the country, but still, which branch are you going to opt for?
Yes, sir. I will be opting for endocrine, sir.
Any specific reason why endocrinology?
It just came to my mind, sir. There is no specific reason, but
All right. So spontaneity is there with endocrinology. Okay.
yes, sir.
Yeah. Do you like reading also, because you have to acquire so much of knowledge also for endocrine? Correct?
Yes, sir. Yes, sir.
All right. Okay. So hearty congratulations once again, Soumya, for your amazing success and a rank of 8 in such a competitive exam. All the best for your future. And thanks for joining.
Thank you, sir. Thank you, sir. Thanks a lot.